The 180th says those flights normally take place during daylight hours, but the pilots and maintenance personnel are required to conduct night operations as well.
Well, it's a rare and heartbreaking story. A mother and her son are both surviving against overwhelming odds. 13 ABC's Melissa Veitch on this story, live to share it with all of us. Melissa.
Well, Lee, you know, it's amazing that doctors can do so much these days to fix congenital heart defects, but there are still a couple that are devastating. And as you mentioned, in sort of a rare and heartbreaking twist, we have a local mother and her son who each have one of these. 30-year-old Tatiana had life-saving heart surgery when she was just 4 months old. She was born with a congenital heart defect called tetralogy of flow. Her heart is simply not formed right. She did fine for years, but when she got pregnant with her son Pierre,
I was more fatigued. I had a very, very high-risk pregnancy.
Her heart was weakening.
Like I was going to die or I'm not going to die.
At the same time, doctors discovered the baby she was carrying had a life-threatening heart defect as well.
He has hypoplastic left heart syndrome. It was hard for me.
That's where half of Pierre's heart never formed. 4 days after he was born, he underwent the first of 3 open-heart surgeries to fix his heart. ProMedica pediatric cardiologist Jeffrey Moore.
If you have congenital heart disease, the chance that your child will have significant congenital heart disease is about 3-fold increased.
Tatiana underwent life-saving open-heart surgery 2 years ago, but like Pierre, it is simply buying her time. Both mother and son will ultimately need heart transplants. It's just a matter of who will need one first.
Some kids with this type of anatomy start to struggle at his age, to be honest with you, and some kids need transplant as young as Pierre is. Some kids go on to their 10s, 20s, even 30s and do fine.
As for Tatiana, you take a look at her, and she did have surgery a couple of years ago, but she still has some profound issues, so it really is too soon to tell which one of them will be on a transplant list first. Reporting live, Melissa Veitch, 13 ABC Action News. Back to you.
All right, Melissa, thank you. Well, as Jay mentioned in his weather report a few minutes ago, all this week you can die now.